I'd like to welcome you to the launch of a report on cancer survival in Victoria, dated 2007. I'm David Hill, I'm the Director of the Cancer Council Victoria, and you're in one of our buildings. We have two buildings. This is where most of our research effort is concentrated. We call it the Cancer Control Research Centre. It also, because of that, houses the Cancer Epidemiology Centre and the Victorian Cancer Registry. I'd like to welcome, first of all, the Minister of Health, the Honourable Dr. Bronwyn Pike. We've also got Professor Dallas English, has supervised the statistical analysis which underpins the report, and he's on the top table there. Dr. Ian Roos is the Chair of Cancer Voices Victoria, he's in the front row, and Professor Richard Bell, the Director of the Barwon South West Region Integrated Cancer Service, and a number of other significant players in cancer control in Victoria. Welcome everybody. Cancer registration is something which is very, very important for the control of cancer. And what that means is that we have in place here and in many, many parts of the world, and I would say in all major developed countries, populations where it is mandated that when a person gets cancer, that information is registered in a central registry. We've had that system in Victoria since 1982, and it's an immensely important tool for controlling cancer because it tells us what the trends are, whether the rates are going up or down in different cancers and across the board and in different places, and we can cut the cake in very, very many ways. So it's an important monitoring, evaluation and research tool. Today we're talking about cancer outcomes, and you might ask, what is cancer outcomes? There are various outcomes for cancer. As you'd all know, it's very difficult for a clinician to pronounce an absolute and certain cure for a person who's been diagnosed and treated for cancer. We can rarely be completely sure that sometime in the future that cancer won't recur. And so we use an important index of outcome, which is the survival rate. And the traditional rate we focus most on is the 5-year survival rate. And you'll see in a little while when Professor English shows you some graphs that it's clear that after 5 years of surviving from your cancer, the chance of subsequently dying from the cancer is very much less than in the first 5 years. So it's not a bad measure. It's not perfect, and it's not a guarantee of permanent cure. But that's what we look at, and we want to see whether we're making progress in extending the overall 5-year survival rate. We want to see whether it's improving, which cancers, and so forth. We have here, as I said, the Cancer Epidemiology Centre, which is headed by Professor Graham Giles and his team, including Vicky Thursfield, who have put a lot of work into preparing this report. The Cancer Epidemiology Centre, which incorporates the registry, is a thriving research enterprise, and I think it's an example of how to maximise the value of a registry for very, very important research, which goes well beyond simply monitoring trends. The report, of course, provides some answers to very interesting questions. Are we doing better now than we were 5 years ago? You'll see the answer to that in a moment. But of course, as with most research, results also pose new and important questions. There'll be more discussion of that in a moment. The report does contain good news. Things are getting better. It provides data for cancer overall. That's combining all sites. That in itself doesn't make a lot of sense for an individual patient because their prospects are determined by the kind of cancer they have, not the overall rate, of course. So it's broken down, and the data are presented for 34 of the common cancers separately. There's trend data, there's some regional comparisons, and there are some benchmarks provided in the report to allow us to assess how we look as if we're doing compared with other parts of the world. And I must say that I think we can be proud in Victoria at the performance of our medical system and hospital system in treating cancer, because we do well. The Cancer Registry pools data both nationally to assist in interstate and national data collections, and also internationally, an important enterprise. But there are differences, and we can't explain them all. Unless we enhance the data which is collected into the Cancer Registry, we'll be very limited in our ability to explain those differences. And it's absolutely essential that we move towards including in the Cancer Registry set of variables which are collected on people, what I'm thinking of as the missing variables about treatment, stage of disease, and so forth. When we have that information, the Health Minister, the DHS, and all those involved in cancer care will be better able to analyse the problem and produce systematic solutions to any problems that we think we have. We can go on improving cancer care and outcomes in Victoria. I'm absolutely convinced of that. One of the tools to do that is good data. Now I'd like to introduce, to ask Professor Dallas English to come up and present some highlights from the report. Dallas shares his time between the University of Melbourne and the Cancer Council. We don't get as much as they do, which is all to the good for them, but we regret it somewhat. But we have very close connections with the School of Population Health at the University of Melbourne through Professor English. Thank you.